Senator Wyden, do you want to ask a final question?
I have one question, then I'm going to brief closer. Mr. O'Neill, I saw a comment you made about wanting every American, this is your quote, every American to wake up vibrant, energetic, and free of disease, and that's President Trump's vision to make America healthy again. But what we have seen in the last 3 months and what we have talked about this morning, as recently as my colleague talking about the safety of firefighters, is we have seen unprecedented efforts in one way or another to derail the ability of Americans to get good health care. So if Republicans are gutting Medicaid, terminating coverage for millions of children and family and seniors, and just in that discussion with my colleague about firefighters, those firefighters and people going to wake up the next morning feeling vibrant?
Senator, as I told your colleague, I have not had a chance to review that particular program, but in general, to answer the first part of your question, it's been frustrating to a lot of people for years that junk food is cheaper than healthy food, that nutritional guidelines are confusing.
I didn't mention junk food. I talked about the programs that are being cut, that are being waylaid, the programs that used to help people, but now they're being studied. You said that Americans ought to wake up, vibrant. I'm, of course, excited about that. That would be a great idea. I just don't see how that's consistent with all these cutbacks in essential healthcare services. So maybe you can tell me specifically how those two are reconciled, that everybody's going to be vibrant when their health care is cut, measles, all these kinds of programs. How does that work?
I'd be happy to try, Senator. So the vision the Secretary laid out for the proposed reorganization was that functions of HHS be preserved and be carried forward in the most efficient way possible, sometimes by combining related functions into the same place, by reducing duplication, by eliminating middle management where that is not a good use of money, and leveraging the department's money and people towards succeeding in the most essential functions. And from what I can tell on the outside, that is the vision that has actually guided the proposed reorganization.
Mr. Chairman, we've got colleagues on the way. I just want to say for this last area of questioning, I think what the witness and both of them are really doing is they're ducking on the question of whether anything is actually going to be done to make America healthy again. And I think what they're offering up is an approach that's going to leave people sicker, a nation living in fear, confusion with unprecedented levels of disease in a modern era. We're supposed to be making progress, guys, in terms of people dealing with these dread diseases, and what we have cited from the time of my opening statement are areas where it's getting worse. And you all are doing studies and you're looking at various agencies and the like. Meanwhile, people are getting sicker. And that's not what we want in America. That's not what we were told we were going to get. It certainly doesn't seem to me to be consistent with making America healthy again. And I appreciate your courtesy, Mr. Chairman, with respect to my colleagues. I believe at least one is on the way, and that should be resolved quickly.
Well, we will pause for a few minutes to see if another colleague shows up for questioning. If we don't get some attendance soon, we will wrap up.